I would like to welcome you all to the presentation titled Designing the Future of the Exercise and Fitness Professions, the Relationship Between Education, Certification, and Employment, presented by Drs. Mayer McGall, Brad Roy, and Ben Thompson. Dr. McGall serves as the Program Director and Professor of Exercise Science and the Chair of the School of Mathematics and Sciences at North Carolina Wesleyan College. Mayer is also the outgoing Chair of the ACSM Committee on Certification and Registry Board. Dr. Thompson is a professor in the Department of Human Performance and the Sport at Metropolitan State University of Denver and serves as the chair of the Committee on Accreditation for the Exercise Sciences. Dr. Roy serves as Executive Director at Kalispell Regional Healthcare in Kalispell, Montana, and is the immediate president of the Clinical Exercise Physiology Association. In today's presentation, we'll gain insights on the integral role of formalized education in preparing exercise science students for the workforce, how certification assesses if they are work ready, and what characteristics employers look for in successful new hires. Without further ado, the floor is yours.
Great, thank you, Francis. So this is Ben Thompson, and I'm going to start talking about academic accreditation. So I'll give a little bit of an overview in regards to what the COAS is and why academic accreditation is important. A little bit of the standards of the profession, and then information about outcomes that the COAS assesses. So my first slide is one by Dr. Wasserman that I just love, that I always show my students whether they enjoy it or not, but it shows the coupling of the external environment to cellular respiration. And I thought this was an excellent way to look at how education, certification, and employment are all interrelated. So what I did was I tried to show how the interrelation between those three things. So if you look at our first cog over on the right, we have our exercise science programs. Our middle cog is accreditation, and the cog all the way on the left is some type of NCCA certification. And the goal of everything is pretty much positive placement and employability. So if you look at the far right, where somebody is accepted into an exercise program, that exercise program has specific curriculum that that student will go through. Once they go through that curriculum, hopefully it is an accredited program. And the COAS accreditation has specific established competencies to make sure that all the students are adequately and equally prepared. Once a student graduates from an accredited program or any program, part of what will happen is that program will then review specific outcomes, and one of the outcomes that is reviewed is pass rates on certification exams, and that relates directly to NCCA certification. And we know that employability, one of the most important things that employers look for are certification and education. Once we have those students that have been employed, it comes back. So we start from the left and go to the right, where those graduates now and professionals determine the requirements, and they help establish the job task analyses for the professions and the certification. And then that goes back to the competencies that the COAS looks at and helps with establish, and it goes then to back to the programs that adjust their curriculum if they need to based on these new professional requirements and go through maintenance. So that it's all very interrelated in regards to education, certification, and employment. So what really is accreditation? And so, you know, this is a definition that KHEP has, the Committee on Accreditation for Allied Health Education Programs, about ways that we can measure against accepted standards. Most of us in education are used to and hear more about institutional accreditation, so things like the Higher Learning Commission or Middle States Commission on Higher Education. So those are bodies that accredit the institution, the whole university. CAHEP is a programmatic accrediting body, so it's a specialization basically. So programs like nursing or physician assistants or exercise science or respiratory care all have programmatic accrediting bodies. And how the COAS was developed was, we've been around for quite a while now. So in 2002, a group of individuals got together and decided that accreditation was going to be an important component of our profession. And in 2004 was actually when CAHEP first recognized the two standards for exercise science, which is undergraduate programs, and then exercise physiology, which are for graduate programs. 2 years later, Salisbury State was the first accredited program in the United States for exercise science. A year after that, personal fitness training standards and guidelines were added, and those are for community colleges or 2-year programs. They're accredited programs. Currently, we have approximately 66 accredited exercise science programs worldwide. Our international one is Shanghai University of Sport, and we have 14 graduate programs, the exercise physiology. One of them's in the University of Auckland. And then we have 5 personal fitness trainer programs. Hopefully with this growth that we see, who knows what's going to happen? Are we going to have over 100 accredited programs in 2020? Who knows? So that's kind of where we see growth and change within the COAS. And why the COAS is important is its accreditation is outcome-based. And so the accreditation is important both for institutions, programs, and students and employers. So when we look at how accreditation is important for an institution, the big component is retention. I know in my institution, retention is an important component of what we try and do is keep our students so they can pay basically, okay? But with COAS accreditation, one of the other outcomes that we track in addition to retention is employment, okay? And that is something that a program can show to their university saying, we do retain our programs and these students are getting employed when they graduate. And that can help with retention of your program if you need to. For individual programs, it can definitely help with identifying strengths and weaknesses within that program. Are there parts that you need to improve upon? Or are there parts that you need to scale back a little bit? Lots of times programs have to go through programmatic review at their institution, and accreditation can be linked with programmatic review as well. And of course, the biggest component of program accreditation is really to prepare students to become entry-level professionals. So for those students, okay, the accreditation creates a kind of a level playing field where everybody is getting the same level of education and experience, and it adequately prepares them for, like I said, an entry job and profession. It also allows students to see what their program is doing for them, to see how much and how often their students are getting deployed or how often they're being retained. And so it can be good for program recruitment or program retention as well. And hopefully it gives students something to be proud of. And they can say that, yeah, I came from one of the few accredited programs in the United States, okay? When we look at the profession or the industry, accreditation isn't as widely known, but hopefully it will become more widely known. When we look at the most current worldwide survey of fitness trends, education and certification can kind of be linked to 3 of the those fitness trends. So number 10 is employing certified fitness professionals, and this can relate directly back to accreditation. Licensure for fitness professionals as well. So we aren't in a position to look at licensure, but licensure is similar to certification, and then outcomes measurement. So these students that are going through these programs, what's the outcome? Are they graduating on time? Are they being able to take and pass certification exams? And ultimately what can happen is it can give the employers knowledge about what kind of employee they are going to be hiring. So they know everybody has certain skills and certain knowledge. And ultimately it's going to move the profession forward by aligning education, certification, and employment. So the COEAS accreditation is, I think, is often mistaken, and people call it ACSM accreditation, and it is not ACSM accreditation. The standards that are taken and used for the competencies in accreditation are taken from multiple certifying bodies, and the COEAS has a number of different sponsoring organizations. So NASM is one, ACSM is one, the National Council on Strength and Fitness, NCSF, ACE, the American Kinesiology Association are all bodies that contribute to the standards and competencies that the students are required to learn. And so it's not just one organization that is dictating what these students should be learning. It's taken from kind of a multi-disciplinary approach and view. So one of the major outcomes that each program collects each year is retention rates. And so what I did is, this is by no means a scientific study. This was just me interested in looking at program retention rates based on our accredited programs, which you see it in the left side in the orange bar, retention rates from that same institution that I got from their websites, and then retention rates from similar institutions in the area based on enrollment size. And you'll see that accredited programs through COEAS have an approximate retention rate of, close to 83%. When we compare that to their institution, they have a significantly higher retention rate compared to their overall institution. However, when we compare the accredited programs to similar institutions based on size, the significance isn't as noticeable, and so it's not significant. But it's just interesting to see that these programs have this retention much better compared to overall retention at their institution. And so this is just one of the outcomes that programs collect each year to make sure that everything is going well. So what's really the role of the COEAS? So, overall, we're there to just kind of establish standards and guidelines for these academic programs that are going to help facilitate their students' preparation that are going to be seeking employment in the health, fitness, or exercise industry, or even some type of other positive placement, like going into a graduate program or service in the military. The second role of the COEAS is to give some type of process for programs to go through some type of self-study to look at what they do and how their program is set up, to review it and give some type of recommendations for those programs that are seeking CAHEP accreditation. What we don't do is we do not dictate the name of your program. We don't tell you what classes that you can or can't offer. We don't help you get more release time or get equipment for research. That we don't do. But what we do is really based on for the students and giving those students the education to be successful when they graduate and hopefully become employed in our industry. If you would like if you have any questions regarding accreditation, our Executive Director, William Cole, can be contacted. You can see his email here, or you're more than welcome to contact myself as well if you have any questions regarding this. So thank you for your time, and I will pass this on to Dr. McGraw.
Thank you, Ben. Francis, thank you for the nice introduction. So let me talk a little bit about, hold on. Let me talk a little bit about ACSM professional certification. I'll cover it in a few slides. I would like to start with a short historical perspective. As most of you are aware, ACSM was founded in 1954. In 1974, and as part of ACSM effort to gain new interest, growth, and visibility, the college hosted an invitational conference on implementation of ACSM exercise testing and exercise prescription guidelines in Aspen, Colorado. In the conference, ACSM members finalized plans for a proposed certification process for exercise program director and exercise leaders. So in terms of the history of the certification, it started in 1974. In the following year, 1975, ACSM guidelines for graded exercise testing and exercise prescription were first published, and exercise program director and exercise specialist, what is now the CET, certification were introduced. The exercise test technician certification was first offered in 1976, and ACSM health fitness instructor, which in the meantime changed from AGFI to AGFS, now it's exercise physiology certification, started in 1982, followed by health fitness director and exercise leader certification in 1986. Currently, ACSM is offering 4 course certifications and 4 specialty certification and credentials. I will describe and discuss the core certification in the next few slides. It is important to point out, however, that each one of the core professional certification is geared to serve unique population and programming focus, and we'll talk about it in a few minutes. In ACSM, the committee that is responsible for certification is the Committee on Certification and Registry Board. And I will discuss the structure, mission, and vision of CCRB toward the end of my presentation. Francis, could you move the slide forward, please? It is an important question in terms of the purpose of certification. An important question an exercise professional should ask him or herself, should I become ACSM certified? And unequivocally, the answer should be yes. It is important to point out that professional credentials in the health fitness industry and in clinical exercise settings, such as ACSM certification, play a critical role in the development of exercise professionals. In fact, ACSM certification in conjunction with appropriate academic preparation, namely attending accredited institutions, for example, as mentioned by Dr. Thompson, should be viewed as a pivotal pillar of the professional development of exercise professionals. On the employer side, it will be discussed by Dr. Roy a bit later. By gym owners, fitness facility managers, and hospital administrators should strive to hire ACSM certified professionals to ensure gold standard quality and reduce potential liability. It is important to point out that the attainment of certification is a voluntary process in which ACSM grants a time-limited recognition use of credential to individuals who comply with the eligibility requirement. Meaning, after 3 years of being certified, a certified professional needs to continue and take continuing education credit in order to maintain the certification. As mentioned on the slide, the the certification granting organization have a responsibility toward the public, the employers, and exercise professionals. Next slide, please, Francis. ACSM offers 4 core certification and 4 specialty certification and credentials. The core certification are divided to 2 categories: health fitness certification and clinical certification, and include the following: ACSM certified group exercise instructor, ACSM certified personal trainer, ACSM certified exercise physiologist, and ACSM certified clinical exercise physiologist. In a few minutes, I will describe the difference between these certifications. In terms of the specialty certification and credential, they are an add-on to an existing certification and are geared to broaden one's expertise. These include the exercise medicine credential, ACSM ACS certified cancer exercise trainer, which is a collaboration between ACSM and the American Cancer Society, ACSM NCH PAD certified inclusive fitness trainer, which is a collaboration between ACSM and the National Center on Health, Physical Activity and Disability, and ACSM NPAS, Physical Activity and Public Health Specialist, which is a collaboration between ACSM and the National Physical Activity Society. Next slide, please. In terms of the health fitness certifications can be divided to 2 groups: group exercise instructors, GEIs, and personal trainer CPT certification that do not require 4 years college degree, and exercise physiology certification that require a minimum of a bachelor's degree in exercise science, exercise physiology, or kinesiology. When we look specifically at GEIs and CPTs, GEI eligibility requirement include being 18 years of age or older, have a high school diploma or equivalent, and have an adult CPR AD certification. GEI, for the most part, work with apparently healthy individuals by providing set instruction across many class types and equipment sets, including small and large groups. CPT's eligibility is the same as GEI eligibility. CPT is working, for the most part, on one-on-one settings. Exercise physiology eligibility requirement include bachelor's of degree in exercise science, exercise physiology, kinesiology, as I mentioned, and have an adult CPR AD certification. EPs work in different settings, include but not limited to university setting, corporate, commercial, hospital, and community settings. EPs provide advanced level training by conducting and interpreting physical fitness assessment and developing exercise prescription for people who are apparently healthy or have medically controlled disease. Next slide, please. Next slide, please.
Mayor, it's showing the clinical exercise physiology.
Oh, thank you. In opposed to the health fitness certification, the one clinical certification, the clinical exercise physiology, CEP, requires a master's degree in exercise physiology or equivalent and 600 hours of hands-on clinical experience, or bachelor's degree in exercise science, exercise physiology or equivalent, and 1,200 hours of hands-on clinical experience. In addition to that, basic life support provider or CPR for professional rescuer certification. In practice, the CP provides primary and secondary prevention strategies designed to improve, maintain, or attenuate decline in fitness and health in various populations. The CP also prescribes exercise, basic health behavior intervention, and promotes physical activity for individuals with chronic disease and conditions. I also want to take this opportunity and briefly describe the Clinical Exercise Physiology Registry. The registry was co-developed by ACSM and Clinical Exercise Physiology Association, CEPA. Generally speaking, the registry is used to raise the visibility and the unique value clinical exercise professionals provide to healthcare teams and increase the exposure of CEPs to professional opportunities. Next slide, please. Another perspective in terms of the differences between the different certification is the relationship between education and experience and participant risk. Generally speaking, this relationship is direct, as you can see on the slide. Both the ACSM GEIs and ACSM CPT require the lowest level of education. At the same token, work with the lowest risk participants, which are apparently healthy individuals. The ACSM exercise physiologists require a BS degree in exercise science, exercise physiology, or kinesiology, as I mentioned, and they work with apparently healthy or those with medically controlled diseases. The ACSM CT require a BS or MS degree with many hours of hands-on clinical experience, as I described in the previous slide. However, ACSM CPs typically work with the highest risk participants, those with chronic diseases or conditions. Next slide, please. For the last two slides, I want to talk very briefly about the CCRB. Very briefly, as the chair of CCRB, many times I have been asked about the different aspects of the business side of developing and managing the various ACSM certifications. I want to point out that the CCRB play an important role. The goal of CCRB is to serve ACSM certified professionals. As you can see, there are 4 credentialing committees, each made out of 7 to 9 subject matter experts. On the CCRB board, these credential committees are represented by the chairs, in addition to continued professional education, international ethics, at-large, and public members. Next slide, please. As I mentioned, CCRB is responsible for the oversight of all ACSM certification programs and supporting ACSM certified professionals. These objectives are clearly defined in the CCRB mission and vision statement. At the present, CCRB mission is to develop, maintain, and administer accredited certification program and provide top quality opportunities for lifelong career development. In other words, providing ongoing and unwavering support to our certified professionals. Moving forward, CCRB strives to position exercise professionals as essential members of the healthcare continuum by being global leaders in credentialing, continuing education, and ethics, meaning shape and mold the future of exercise science, exercise physiology, and clinical exercise physiology leaders. Thank you. Brad, the floor is yours.
Great, thank you, Mayor. So really finding a job is much more than just a grades and a degree. Certainly employers are really focused on people that have good educations and strong experiences, but really one of the other things that's really super important is how well do you fit into the organization that you're trying to be employed by. What is your, we also look at your breadth of academic preparation, your variety of experiences and activities. So it's just not experiences that are focused directly on the job that you're applying for, but what's the breadth of that? What else do you bring into the employment world and things that you can add to that organization? What certifications do you hold? Is it just one? Is it multiple ones? How well have you tried to advance your career? What is your specific job-related practical experience? So how much hands-on work have you done through internships, volunteer work, other types of things? All those are really important to an employer when they look at prospective candidates for any position that is coming open. As you apply for a position, one of the basic things, one of the first things that you should prepare and send in is just a letter of introduction and your resume. The letter of introduction really tells the employer, who are you? Why are you applying for this position? What is your interest in it? And what is it that you bring to our organization? I think a good letter of introduction sets you apart from other candidates that just send in a resume or some kind of an application. Secondly, the resume is really, really important. I can't tell you how many times I've looked at a resume with spelling and grammar errors, sentences that aren't completed, they're terrible. And those are usually the ones that go right to the bottom of the pile. And it could be a really good candidate, but those are things that just really stand out. And when you get 50, 60 applicants into a position and you're trying to go through those and narrow your candidates down, those are things that really, really stick out. So taking a little bit of time and putting that resume together is really critical, I think, to getting into that interview process. Next slide, please. Another piece that's really important as far as getting into that job interview and what is it you take is your experiences you have. So you want to try to get as many internship opportunities as you had, and frankly, those are tremendous feet in the door opportunities. I know in my experience here in Kalispell over the last 25 years, we've had a number of interns that have come in, they've done phenomenal jobs with their internships, and they ended up being hired into an open position that we had at the end of their internship. So it's a great opportunity to get your foot into the door and to sell yourself and to show the skills and your willingness to learn and to develop over time. And then the other piece that the internship gives you is exceptional references that you can use out in applying to different positions as you continue on in that process. Secondly, not everybody starts at the top, and you really have to be willing to come in at a beginning level and then really prove yourself. You know, be an exceptional worker, be a team player, be willing to do anything that you're asked and to do it better than anybody else. Show that you have this willingness to learn and to advance yourselves. You know, it's not about just coming in with this great education and these experiences and boy, I'm going to advance right at the very top. Sometimes you have to work yourself up, and all those experiences along the way make you much, much better later into your career. One of the things that's super important to employers that is really hard to train, but something that you're going to have to really sell yourself on, are your people skills. They are critical. How well do you interact with others? What's your ability to communicate verbally, writtenly? What kind of a countenance do you demonstrate? Do you smile? Do you make eye contact? Are you easy to communicate with? Those kinds of skills are really, really challenging for an employer to develop in somebody. There's something you really need to bring into the job, but it's something we all look at in that interview process. So something really important to be thinking about. People come into our facilities, into our places of work with an emotional gas tank that's filled to some degree based on all the things that they've gone through during the day. And we really want them to leave our facility, to leave our workplace with that gas tank more full and not less full than when they came in. And the way that we as professionals interact with people is going to determine what that is. So it's really, really important that you have those people skills and you can apply that to the team that you're working with along with those customers that you're taking care of. And then really it needs to, what you get into really shouldn't just be your job, somewhere where you go and you collect a paycheck. You really ought to find your passion. This ought to be something that you're passionate about, that you really want to do, that you're driven to really advance yourself and to make a difference for others. Next slide, please. As you start preparing for a job interview after you applied and maybe you get a call that you're going to be able to go into an interview, you really need to prepare ahead. There's too many people that just kind of show up and they're ready to wing it, and they almost fall flat on their face when they start getting asked a lot of questions. So spending a little bit of time and really researching the organization that you're applying to, really understanding who they are, what their culture is, what are their goals and objectives, how do you fit into that organization. Doing a little bit of that homework ahead of time will really help you in that interview process. And then think through some questions ahead of time that you're probably going to get asked. What am I passionate about? Why am I applying for this position? You know, why should you hire me? How do I fit into your culture? Or how do I handle challenges or questions that I guarantee you most interviews are going to come out and ask you? You should be thinking about what are my long-term goals and how does this position fit into those goals, and how do I do my continuing education and try to advance myself, are all things to think ahead about. Be prepared to answer those kinds of questions in your interview process. Next slide, please. And then the interview, make sure you're on time. That's one of the first things that I think gets in a snag for a lot of people is they're late to their interview. So be there, be dressed appropriately, be professional. It's really not time to come in your sweats right after your workout, but be very, very professional in your appearance. Smile, greet the people that are there, shake hands or knock elbows right now in our COVID-19 era, and thank the interviewers for this opportunity to be interviewing. As you go through the interview process, make eye contact with each one of them. So often I see people staring down at their feet or at the table or looking off into space. It's really important to make that eye contact, to smile, to be genuine. Make sure your answers are very thoughtful. That's where that preparation comes in ahead of time. And be honest. If there's something that you really don't know or something that you haven't done well in the past, honesty really sticks out. We don't always hire the perfect person. We like the person who's very transparent and honest and has learned from their challenges and those opportunities to improve. And then, as I mentioned earlier, study the organization and be prepared to ask some questions yourself. When people come to an interview and they don't have any questions, you kind of wonder how much they really have dug in and thought about the position in the organization. And I put up just a few that you might want to think about. And then following the interview, it's really important to follow back up and not just go away and kind of wait for them to contact you, but send a letter thanking them for the interview, just restating some of the reasons that you've applied for the position, what you might bring to the organization, and how you're looking forward to hearing from them. And I think that goes a long way. Very few people do that after an interview, and it really will help set you apart. Next slide, please. So just to give you a few concepts to think about as you go out into the future, as you head into employment and different opportunities through internships or whatever it may be, just some concepts that I think really instill future success. And one is change. Be ready for surprises. Change always happens. Look at COVID-19, how rapidly that came on and just changed our whole world and changed our environments going forward. Expect that, be prepared for it, don't be surprised, don't be shocked, especially going into a healthcare type of an organization. Change is just reality. Next slide. Calm. You know, in these circumstances like we've just been through, the change always happens, storms always come. It's important to remain calm. Nothing is ever hopeless. There's always an opportunity to find something positive or to learn from those times when things are challenging and to move forward and to make ourselves better. And so that ability to remain calm in those situations is really, really important. Next slide. Communicate. I can't tell you how challenging communication is, even in our organization where we have lots of really high-level professionals that have trained really well. I can tell you that if you survey employees every single year, communication is what comes up. Many times we're not good listeners. We tend to be thinking about what we're going to say and really not listening to what the other person is saying. So that listening skill is so important, and being able to make that communication and clarify things. Practice that, become really good at that. It'll show in your interview, it'll show in your career as you try to advance and move forward. Next slide. Continuous learning is something that's vitally important for all of us. I used to coach my son's Little League baseball team, and after every practice, after every game, I sat them in a little circle and I said, what did you learn today? And if they couldn't come up with something, I just kept asking them until they came with something, because in every single day, every experience we have, there's an opportunity to learn. And we should be looking for those opportunities, whether it's in the day-to-day experiences, whether it's through webinars like this, conferences that we go to, books, journals that we read. Look for those opportunities to be learning at all times and advancing ourselves. Next slide. Team and community. You know, we're really in this era now where teams are really, really important. Even in healthcare, we don't have the isolated physician who's in charge. They're really the facilitator of the team. And we really need to be team players. It's important that we help each other succeed. We're not in it for ourselves. We're really there to help our teammates succeed in order to make things better for the patients, for the clients that we work with. And you really need to come in with that team, with that community kind of an attitude, and really be able to fit into that. Next slide. Consistency and being considerate and empathetic. There's a great video that you can watch here, The Human Connection to Patient Care, that really talks about putting yourself into your patient or your client's shoes and what is it they're going through? Why are they reacting or saying the things that they do or doing the things that they do? It's a really important piece of our profession and our career, not to make judgments or things that we think about people, but to really try to put ourselves into their shoes and figure out, okay, what can I really do to help this person at this point in time? Next slide. Collaboration. I talked about team and this whole collaborative approach and how important that is. When I travel through the redwoods down in Sequoia National Park, I've often wondered how these humongous trees that are so tall, that have very, very shallow root systems, stand all these storms. We had a huge thunderstorm come through Kalispell yesterday. It put 35,000 people without power for the entire day, and all these trees fell down over the place. I've always wondered why these redwood trees can last for all the length of time that they do. And what happens is that their root systems are interlinked. And it's not that the isolated tree is able to hold itself up. It's those interlinked root systems that hold the forest up and keep it together. And that's really what it is about being a team and that collaborative approach. And that's how you want to come into your job, into your new roles. You really want to be a great partner within that. Next slide. Courage. You know, sometimes we look for the easy way out, or we're afraid to maybe say things in meetings that we need to be saying, or to do certain things. And it's really, really important to have courage, because courage really is a catalyst. It helps us to improve. It gets things out on the table that need to be out on the table. A great example is this one girl that in 1940 that was born in Clarksville, Tennessee. She was the 20th of 22 children, and she had a really tough childhood. She went through measles, mumps, scarlet fever, chicken pox, double pneumonia, you name it, she had it. And then in 1947, she came down with polio. Next slide. The effect of that polio was almost devastating, but she never gave up. This girl, Wilma Rudolph, in September 1960, won 3 gold medals in the Rome Olympic Games, in the 100-meter sprint, the 200-meter sprint, the 400-meter relay. She worked hard. She didn't let all those things get in her way. She had courage. She pushed herself, something that all of us can learn from, and that's a very important trait to instill within ourselves, whether it's in our personal life, our athletic life, or even into our work life. Next slide. And then work really needs to be your calling. It's more than just a job. If you really just want a job, I don't think that healthcare or the fitness industry really is the place for you to be. We're in the people business. We're all about taking care of people, helping people to become more fit, to become more healthy, helping our teammates to do better and to be successful. And it really has to be our calling, something that we're just passionate about and really, really dedicated to doing. And if it's just about coming in and getting a check, or maybe trying to get to the next level of our career, it's got to be more than that. And I really encourage you to really dig down deep and to really think that through. And what is it I'm really passionate about? Next slide. And then finally, you know, work is challenging. We've been through some really, really tough times in the last couple of months in our whole society. Some people have been out of work. Other people have been working twice as hard as they were before. These things happen to us all the time. And we have to step back and realize, you know, it's not the end of the world. These couple months are changed, they're tough. But, you know, this is really a marathon. It's not a sprint. And there's things that are important that we have to take care of our own selves. Our nutrition, our exercise habits that we have, our camaraderie in relationships, quiet time, being able to get aside and to think and to really plan things out. And this whole happiness factor, you know, we have a choice every day. We can look at the negative side of things, or we can look at the positive side of things. And I guarantee you, things will go a lot better if you keep looking for that little bit of positive in everything that happens. Next slide. And then finally, we have to move, we have to exercise. I can't start a day without doing my exercise session in the morning. If I have a really early meeting, I get up even earlier to get something in. We need to move. There's the running track of the future, going around the escalators. We really need to put into that habit. That's what we're trying to instill in our clients and patients, but a lot of times we forget about it within ourselves, and something we really, really need to focus on and make a part of our lifestyle. Next slide. So I'll leave you with this last thought by Sir Winston Churchill. It said, we make a living by what we get. We can all get a job, we can make money, we can make living, we can try to get to early retirement, but the reality is we make a life by what we give. And our profession, whether we're working as a clinical exercise physiologist in a healthcare setting, or an exercise physiologist, or a group exercise instructor, or a personal trainer, our mission, our passion is to help people improve their lives, and to really be in that person's life and to be there for them. And that takes that whole commitment, that calling, and everything. And that's where I'll leave you. If you can really sell yourself in the interview, if that's really how you come off and have that passion, your chances of getting a job, getting your foot in the door, and then moving through your career in a very successful way are going to be very, very good. So with that, I'll draw this piece to a close, and I'll turn it back over to Francis.
I want to thank Dr. McGall, Roy, and Thompson in providing a wonderful overview of the journey of becoming an exercise professional. Some great insights of, what do academic programs do to really kind of ensure that a student who's going into the program is adequately prepared for the profession, kind of thinking about putting the right tools in the toolbox. And then certification on, how does ACSM put certifications together to make sure that there's fair, reliable, and valid exams, but really kind of emphasize on the public trust, and how do I ensure to the public that certified professionals are safe and effective in various levels of ability for different clients, from those who are generally healthy to those who have various health challenges. So how do we do that in the intersection of education and certification? And lastly, the insights from Dr. Roy on what do employers look for outside of just certification and education? It's beyond just those two pieces. And how does an exercise professional, what is their willingness to learn and develop as an exercise professional? Their human skills of working with a patient, within a team, and then also with management. How do I make those deep connections within a program? And then lastly, just kind of like, being able to live your passion and adding value to your employer by your continuing growth as a professional. Up here on the slide, you'll be able to